friend. How awesome is she? I have to say, I'm just super excited, and I'm so honored to be asked by Sharon to tell you a little bit about my experience and the impact the MS Society has had on my life. I know it can be really difficult to see exactly how riding a bike 150 miles or 90 miles or however many miles that you manage today helps to affect those of us affected by MS, or how that action could possibly be getting us closer to a cure. But by sharing parts of my story with you, I hope you can see the lasting impact that your time and fundraising are making. I get really passionate when I talk about the MS Society and the influence that the volunteers and all of you members have had on my journey. I was diagnosed with relapsing remittent multiple sclerosis in October of 2010. My daughter was a kindergartner, and now she's bigger. I was newly dating the man who would later be my husband and the operator of my slideshow. I was working all the time, single momming it, and then I couldn't feel my feet. And then I couldn't feel my left hand. And I had no idea that I was about to become 1 in a million. My story is similar to so many others, so I'm not going to go into the finer details. But when I got the call from my neurologist that I had a diagnosis of MS, time just stopped. I remember exactly where I was, waiting for my work day to start because I was at work when they called me. I was holding the phone and listening to the words and not really hearing them. I'm so sorry, but you have multiple sclerosis. And I just felt so alone. I knew so little about multiple sclerosis. I'm a nurse, and I had the privilege of working with an amazing team at Blair Plastic Surgery for almost 8 years. Lasering stuff. I was only in my 3rd year with the practice when I was diagnosed, but even as a nurse, I wasn't exactly sure what I was supposed to be doing next. So right after my diagnosis, my neurologist prescribed a disease modifier. A disease modifier is a medication that helps slow or even stop the progression of MS. There are many different treatment options available, and I wasn't aware of any of them. I was contacted by a patient advocate. A few moments into our initial conversation, and me just spewing my emotions of how I was so scared, and I didn't know what to do next, she stopped me, and she identified herself as my insurance company's patient advocate, and let me know that the purpose of her phone call was to let me know what my co-pays would be. I can't always blame the brain damage for how some of this stuff just killed you. Oh, thank you. That conversation was followed by receiving a magazine in the mail. It was a catalog of durable medical equipment. I already felt like my life was not my own, and now I had a magazine of wheelchairs and hospital beds coming directly to my house. That feeling of isolation and not knowing was completely overwhelming. Part of my saving grace was seeing a small page in that catalog for the National MS Society that directed me to the website nationalmssociety.org. All of the information I craved was there, and through the easy-to-understand guides, we became experts on explaining to our families and friends what MS was. There was contact information for support groups, physical and virtual support groups. There were people sharing their stories through the MS Society, and they were just like me. The website even had easy-to-use guides for employment, insurance, long-term care planning, everything. I got a copy of Momentum magazine and the quarterly national publication of the MS Society. Many of you are aware of it. We downloaded and printed copies of Keep Smiling, a magazine geared towards our kids, and my daughter shared them with her kindergarten class at school. I'm just going to throw this in. I know there's another part of my typed stuff. My husband's probably looking at his notes going, I don't know what you're talking about. But Keep Smiling You can see these kids across the front. I actually took this off of the website recently. You can see what they said. Hi, we're Michael, Crystal, and Ben, and each one of us has a parent with MS. I just want you to know these resources are there because our kids get scared, and these kinds of things really help with that. The chaos of early diagnosis was still ongoing, but we had resources. 3 months after I was diagnosed, my insurance changed, and my first disease modifier and my neurologist were no longer covered. I switched to doctor number 2 and a second medication. I felt like I wasn't doing anything to get better. I was just a passive part of my care. Interventions weren't personal. Things would be done to me instead of with me. And I started getting frustrated, and I started getting angry. I'm a nurse, and I believe in the power of patient involvement. I knew through the information I was receiving from the MS Society that there was more out there. The final straw came when my second neurologist made the prediction, based on what he was observing as a rapid progression, that I would be in a wheelchair in a year, and recommended I quit my job then to spend what time I had left with my family. I got back on the MS website and I contacted the MS navigators. Within minutes, I was being armed with information that was useful and actions that I could take. My husband and I made the decision to self-refer to a comprehensive care center, a place where MS was not only the priority, but where research was happening. I was looking for a place where I could become an active participant in my care. I was looking for a team. We made our first trip to the Johns Hopkins Multiple Sclerosis Center March 9, 2011. We went with my physician. Isn't he great? His nurse practitioner and his clinical nurse. We spent hours in Baltimore that day learning about multiple sclerosis and how my specific disease was going. Together, we formulated a plan, a 1-month plan, a 3-month plan, and we talked about our long-range goals. We learned about ongoing research trials and what would be appropriate for me. We developed a relationship that we still have today as we continue to fight on. In a funny twist, a few years later, when we were talking about BikeMS and how much we love it and everything, we learned that his fellowship was paid for by the National MS Society. Fundraising 15 years prior had made this doctor's next-level education possible, impacting thousands of lives. Meanwhile, for me, the MS navigators were there every step of the way. For those of you who aren't aware, MS navigators are trained professionals who have the MS person's best interest in mind, not necessarily the insurance company and not necessarily the pharmaceutical company. The fundraising that we do helps make their services readily available to all at no cost. The navigators got me in the right hands for all of my questions, whether it was copay assistance programs or unbiased background on treatment options. With the addition of the navigators and a supportive clinical team, we started living our accelerated version of dreams. We leased a farm, and we started living a dream that included chickens and goats. We got married. We were actually in Baltimore the day before our top secret farm wedding. My care team knew before my parents that we were getting married. I started running with the blessing and encouragement of my care team, but mostly out of spite for that doctor and his wheelchair prediction. I ran the Hershey Half Marathon. But wait, it gets better. I ran a ridiculous amount of 5 and 10K races, and I ran 500 miles in 2014. I have had some bad days and good days, and as a family, we just kept communicating, and we kept working through it, and together we found our new normal, and we stopped feeling like we were so alone. I was so impacted by how the MS Society had touched my life on multiple different levels that I wanted to pass it on. I wanted to pay in my sweat equity to this. We, as a family, felt like it was important to pass on the information that we were gathering, and we fought our fight transparently. We tell people what's going on. But we wanted to start raising money too. So we formed a team for BikeMS, and the Mylinator name was born, thanks to my husband, and we walk at the annual event here at State College. My bosses and some of the nursing staff were already road cyclists. Some of you people from Lake are going to recognize people that we poached from your team, I'm sorry. Things I didn't know until earlier. The Blair plastic surgery myelinators would start to become regulars at this ride. In 2012, I had my first experience watching rider after rider cross the finish line at the Keystone Country Ride. And I was blown away by not only the fundraising that was accomplished, but by the incredible spirit that the riders and volunteers had. So, I made an overly ego-driven statement to my bosses that if I could walk the next year, I would ride the next year. So we signed up, and I bought a bike off of Amazon. The bike was actually called a GMC Denali, and I think it might have weighed about as much. Yeah. We raised our funds, we trained less than we should have, and with the blessing and encouragement of my clinical team, I rode. And I had an incredible experience as a first-time rider. The support was beyond anything I could have ever imagined. And you, the riders on the course, were encouraging and cheered me on every mile. I had received an I Ride with MS jersey, and it opened up so many conversations and lots of hugging, lots of hugging. Wait, go back.
Oh.
Oh, wait, no, that's not the one. All right. Our volunteers from Blair Plastic Surgery were back at the finish line for a second year too. So, to finish with my work family around me, the ones who were watching me fight every single day, to have them share in the success of a great ride is something I just really have a hard time expressing. Coming across the finish line became a touchstone for me, proof that I had fought hard and survived another year, and a promise that I would do it again. So I did. In 2014, we signed up again. We set a higher fundraising goal, we hit it, and finished the ride strong. We signed up again in 2015. We set our highest fundraising goal and surpassed it. But during the ride, I struggled. I struggled more than I had previously. I just felt off. I finished again, but just barely. 2015 would mark the beginning of a really challenging 2-year period for me. I would have multiple flares and new lesions on my MRI. I would have my first MS-related hospitalization. I would begin to rely heavily on not only my clinical care team and the MS navigators, but other society resources. We made the hard decision to move off the farm when the 3 flights of stairs became hazardous. I stopped running marathons and started using walking sticks to get safely through my harder days. But seeing stories of other young moms like Jamie Lynn Sigler, mezzo-soprano, in Momentum magazine really helped soften the blow of deciding to need to use a walking aid. And as a family and as a team, we fought on. I started rehabbing, tried to recuperate, and adjusted to this new course. Again, I was overwhelmed with wanting to pay back the MS Society in any way that I could. While 63% of the total revenue of the MS Society is generated by Walk and BikeMS, I wanted to give differently. I enrolled in multiple research trials. We have an incredibly rich legacy of research with the MS Society, especially when you consider that the Society was founded in 1946, and 1947 would see the launching of the first 3 clinical trials. Bet y'all didn't know that. It's on the website. I have tried medications that show promise for remyelination. I've altered my diet to take a closer look at gut health and inflammation, and I've had extensive imaging done, including a closer look at my pupils to help evaluate early warning signs of MS. My greatest research trial claim to fame, though, was being assigned to the now retired patient identifying number of 007. I traveled to Philadelphia, I ran an amok fest with a group of State College women, which helped raise money for the National MS Society and awareness about the disease in a completely different way. I was part of training sessions for MS navigators in 2018, specifically looking at how to help patients find comprehensive care centers exactly like they did for me way back in 2011. And this year, I shared a part of my story in Momentum magazine, focusing on cognition, an area that MS Society funded a study on that is changing the way practitioners screen patients. In fact, I'm going to give a nod to my table mate and new best friend. That study that was published earlier this year is the reason why the majority of neurologists seeing MS patients do those screening tests at every appointment. That was not something, and a lot of you who were diagnosed when I was or earlier, remember that that's not something that was always done. They weren't always looking at the changes that we were having. So there you go. That's why we raise money for this kind of stuff, because this is groundbreaking and it changes everything. So many things have changed since I was diagnosed. There are new disease modifiers, new recommendations, new protocols. But what hasn't changed is the attitude that we adopted early in my fight and what the MS Society says too, whatever it takes. We send MS advocates to the Senate to make sure meaningful care is accessible, research is fully funded, and that there's accessible and affordable medications for all. We make phone calls and we write letters. I voluntarily have spinal taps, MRIs, and I give tissue and blood samples to further the research effort. We ride our bikes, and we walk laps, and we jump in mud pits. We donate and we fundraise. We make meaningful connections. We share our stories, and more than anything, we'll do whatever it takes to find a cure for multiple sclerosis. Your fundraising matters. Your support matters. And you each have had far-reaching impacts in my life and the lives of so many others affected by MS you may never fully recognize. But most importantly, you have become part of my team. And I thank you for that, from the bottom of my heart, for volunteering to be here today. Thank you.